Mydocalm injections is a centrally acting muscle relaxant. It has a membrane-stabilizing, local anesthetic effect, enhances peripheral blood flow regardless of the influence of the central nervous system. Indications: treatment of pathologically increased muscle tone and spasm of striated muscles resulting from organic diseases of the central nervous system, damage to the pyramidal tract, multiple sclerosis, cerebral stroke, myelopathy, encephalomyelitis, treatment of increased tone and muscle spasms, muscle contractures accompanying diseases of the organs of movement, including spondylosis, spondyloarthrosis, cervical and lumbar syndromes, arthrosis or large joints, rehabilitation treatment after orthopedic and rheumatological operations, as part of a combination therapy of obliterating vascular diseases, atherosclerosis obliterans, diabetic angiopathy, thromboangiitis obliterans, Raynaud's disease, diffuse scleroderma, diseases arising from disorders of vascular innervation, acrocyanosis, intermittent angioedema dysplasia, Little's disease, infantile cerebral palsy, and other encephalopathies accompanied by muscular dystonia. How to use: administer to adults intramuscularly 100 mg 2 times per day, or intravenously slowly 100 mcg 1 time per day. Contraindications: hypersensitivity to any of the components of the drug, myasthenia gravis, children's age up to 3 years. Special instructions: the use of the drug does not affect the ability of patients to perform work that requires increased attention and speed of psychomotor actions. With the simultaneous use of Mydocalm enhances the effect of nifurtimic acid. Therefore, if necessary, the use of this combination, it is necessary to reduce the dose of nifurtimic acid. Although tolperisone has an effect on the central nervous system, the drug does not cause a sedative effect, so it can be used in combination with sedatives, hypnotics, and drugs containing ethanol. Does not affect the effect of ethanol on the central nervous system. Side effects: muscle weakness, headache, hypertension, nausea, vomiting, abdominal discomfort. When the dose is reduced, side effects usually disappear. In rare cases, allergic reactions occur: pruritus, erythema, urticaria, angioedema, anaphylactic shock, bronchospasm.